and care for our most vulnerable populations. When I was first approached by the state regarding guardsmen filling the role of temporary nurse aides for facilities with COVID-infected staff shortages, I obviously had concerns. I wondered what this would do to our force, to our retention. I wondered what this would do and how our soldiers would respond. But I also knew at the end of the day, we're all soldiers and airmen. We follow orders. If this is what our state needed us to do, this is what we would do. And if we're going to do it, we would equip and train our force for the mission. In consultation with the Department of Health and the Department of Public Safety, we developed a training plan to train our non-medical soldiers and airmen to care as temporary nurse aides. The training is conducted by medical professions and certified by the Department of Health. We currently have more than 270 guardsmen assigned to 11 teams trained in conducting this role in facilities throughout the state, with an additional 100 coming into the training pipeline. I know I am safe in saying not one of our soldiers or airmen envision themselves performing care in a long-term care facility when they voluntarily rose their hand and joined the Minnesota National Guard. And I wholeheartedly wish we did not have to do this mission, but the fact of the matter is we are. These residents in long-term care facilities are real people, and they require real care. To date, the Minnesota National Guard has supported 17 long-term care facilities, and I'm certain that number will continue to grow. Fortunately for the state of Minnesota and the families of those who have residence in these facilities, I am confident our soldiers and airmen will perform this mission with professionalism, treating the residents of these facilities with care, dignity, and respect. I'm happy to say these soldiers and airmen are doing well. Some of my leaders visited these soldiers on Thanksgiving Day. These service members talked about their interactions with residents who unfortunately have been isolated in quarantine and hadn't been able to see their loved ones in some cases for months. The residents were very gracious and appreciative for the support and care given by our soldiers and airmen. I will quote one young soldier who said, "Training for my wartime mission is one thing, but helping people in our communities is why I serve in the National Guard." Undoubtedly, our service members would rather spend the holidays with friends and family, but they understand right now they have a mission for the greater good of Minnesota. That is what selfless service is all about. These National Guardsmen left their families, their jobs, and schools because they were ordered to fill critical roles in the front line, along the front line in the fight against COVID-19. But they can use your help. Contact tracing confirms that these long-term care facilities are being put at risk, not from inside their walls, but from outside. We need your help to lessen the community spread. And I'm begging you on behalf of the 13,000 soldiers and airmen in the Minnesota National Guard and their families, I ask you to please follow the simple rules. Wear a mask when you're in public. Limit your potential exposures when you can. Follow the CDC and Minnesota Department of Health recommendations and temporarily adjust your lifestyle to limit the spread of the disease. Doing this will help our healthcare workers, first responders, and other essential workers stay healthy and stay on the job. None of us like this, but all of us can make a difference if we work together in this fight. Thank you. It's my pleasure to introduce Nate Shima, the Vice President of Operations for the Good Samaritan Society. Thank you.
Governor Walz, Commissioner Malcolm, thank you for the invitation to join you here today, and thank you for your leadership and support of long-term care residents, frontline workers, and certainly our families. I'd first like to share an experience we've just had in Black Duck, Minnesota, just over a week ago, where nearly half of our employees tested positive and nearly 24 out of 27 of our residents tested positive for COVID. While we had planned and prepared for these situations, it truly does take a village to respond and navigate in a crazy time like this. And I'm just so grateful for the support of our governor, state and local officials, for the way that we've rallied and come together as a family. Within hours, we had 5 nurses that were on site within our responding on site through the coordination of local and state officials. And today, I'm here to tell you that we have 12 nurses from all kinds, from all over the state, there to serve our residents. The Good Samaritan Society has 50 locations, skilled nursing facilities, and assisted livings across the state of Minnesota, from International Falls to Stillwater to St. James, Minnesota. Our focus continues to be on providing exceptional quality and faith-based care. We're deeply grateful to the frontline staff for their relentless commitment to caring for our residents throughout this pandemic. They have worked long hours and sacrificed immensely time with their families to be where they've been needed most to care for our residents. These last several months have been emotionally and mentally challenging, not only for our residents, but for our staff. They truly are our heroes. Why we're here today. Each of us has a responsibility to slow the spread of this virus and protect the most vulnerable in our communities. We know that COVID fatigue is real, but now is not the time to let our guard down. We continue to do everything we can to help our residents stay healthy and safe, and we need our community to do the same. Please continue to follow all the CDC guidelines, wearing a mask, avoiding crowds, washing your hands. Stay home if you're sick, and if you haven't gotten your flu shot yet, it's not too late. This virus does not discriminate. We're seeing widespread cases across Minnesota and in the Twin Cities. And I stand here before you today to say that we've got over 200 residents and team members that are positive for COVID, and we're relentlessly trying to contain it. Unfortunately, this has had an impact on our long-term care staffing and our residents. Overall cases have been up as a result of this community transmission and community spread, but we're better prepared today because of Governor Walz's plan and the support of our long-term care community. We know that families and residents are anxious to be reunited with their loved ones. I'd love to see my 4 grandparents down in Faribault, Minnesota this Christmas time, but I just don't know that that's going to happen. For us to continue to be open to our doors to visitation and expand our ability to more family members, we need that positivity rate to keep coming down. As we fight this virus, we are also doing everything we can to combat isolation and loneliness. Our staff has always cared for our residents like family, but they've taken on some new responsibilities here lately. We owe a debt of gratitude to our employees who have just jumped in to do a little bit of everything. They've celebrated birthdays, the birth of new great-grandchildren, and wedding anniversaries as a symbol of their love for their residents. Our staff have continuously gone above and beyond to use technology. We've had 90-year-olds using FaceTime for the first time. And it's just so incredibly gratifying to see the different ways that we can come together. As difficult as this has been on everyone, we continue to hear from so many families who have thanked us for taking these extra precautions. Just recently down in Jackson, Minnesota, we had a resident write a letter to the editor thanking the governor, state officials, and the Good Samaritan Society for all the restrictions that they put in place to keep them safe. Looking ahead, hope is in sight. As you've heard the commissioner and Governor Walz say, the vaccine is on the horizon. And not to be too cheeky, we continue to say, like the Mandalorian in Star Wars, this is the way. This is the way out. Continue to stay vigilant. With the holidays just around the corner, we are encouraging people to get creative in how they celebrate this year. Whether that means family Zoom calls or celebrating apart, so hopefully we can celebrate together next year. We're all in this together. We will get through this but we need to continue to do our part to slow the spread and protect our most vulnerable in our long-term care settings. Thank you for this opportunity to be here today. We look forward to continuing to work with Governor Walz, the state of Minnesota, and all our officials. Thank you. Turn it over to Christine Dahlman, Springbrook.
Give us the opportunity to say I have spoken.
Good afternoon, everybody. My name is Christine Dahlman, and I'm the Executive Director of Springbrook Village in La Crescent, Minnesota. I'd like to discuss how community spread is affecting our assisted living facility, our residents, families, and staff. We're located in La Crescent, Minnesota, which is just across the river from La Crosse, Wisconsin. Prior to the recent dramatic increase in community spread, we were actually able to open up to general visitors. Our residents and families were so excited when they felt that we were heading in the right direction. Unfortunately, with the dramatic community spread, we had to dial back a little bit and only allow the essential caregivers into the building. Even with that, one of our family members who is an essential caregiver tested positive for COVID, and unfortunately that resident tested positive shortly after as well. One of the tough things about COVID is that you can be contagious without even realizing it. It can spread so easily. Wearing your mask can help so much. I understand that people have concerns about wearing their masks, but this is bigger than you or me. For the sake of our residents and families, please do your part. I want our facilities residents to be able to see their families and friends without being afraid that they will contract this virus or give it to one of their friends. All of our citizens are important. We have so much we can learn from our older generation. We are starting to see the light at the end of the tunnel. Now is not the time to turn our backs on how we can help them and how we can help each other in the process. The faster we can come together for the common good of all of our citizens, the faster we can overcome this. I wear my mask not only to protect myself, but to protect others that I may come near. None of us can control the actions of others. We can only control our own. The choice is yours. Will you help be part of the solution or be part of the problem? Thousands of seniors in long-term care facilities and thousands of family members across Minnesota want to see one another. They want to stay connected. We can't make that happen when community spread is so rampant. Hang in there, Minnesota. Be safe, be smart, and help our treasured seniors stay close to their friends and family. Governor Waltz?
Well, thank you, Chris. Thank you, Nate. To all those folks working in these facilities, during COVID, I continue to say it, of all the challenges, every day I see the beauty of human spirit step up, the folks who do care. There's a story almost every day of staff bringing in a birthday cake, singing when the family can't be there, just things of what humans do for one another, so I'm grateful. And to General Mankey, once again, you're exactly right. Myself have worn that uniform for 24 years. You got the call for flood duty or tornado duty or fire duty or call overseas. I would have never imagined working in a long-term care facility, but I think you're right. The folks who choose to join the National Guard care about their community. They come from that community. You've got folks that are taking off their civilian side, putting on that uniform. We have a responsibility to train them, to give them the tools necessary to go do that job. And I think for Minnesotans who are listening, these teams stand at the ready, and the call can come almost immediately. As these folks would tell you, this cascades very quickly, and all of a sudden one morning you don't know how you're going to care for residents because there's no one to do it. That call goes in, and the Minnesota Department of Health, those nurses and the National Guard show up and do the work, and do it with professionalism, they do it with care, and they do it with compassion. But what I would ask all of you as we wrap up today, if you want to, and we hear this all the time, and I am so thankful for this, that in this country, when somebody sees somebody in uniform, they show the respect to them and ask them what they can do to support them. Show them what they can do to support them. What can I do to help you? This is your opportunity. If you want to help the Minnesota National Guard, put that mask on. Stay socially distanced. And it is so simple. It's not even out of malice. You're filling up with gas, you don't have a mask, and you decide you're just going to run in and pay quickly. The person standing in line behind you may work in that long-term care facility. They may be that guardswoman who's there who's just going home after duty and took off the uniform. It's those types of things that are happening, that spread happens in the community. The next thing we know, it is in our long-term care facilities, and it's one thing to be an 18 to 35-year-old asymptomatic. It's quite another to be an 80-year-old resident of a long-term care facility where just because of the nature of that, it makes this disease much more deadly. So we'll get through this. We've got incredible people. You know that your neighbors are out there to help. You're hearing it time and time again. There is light at the end of the tunnel. That vaccine is setting out there, but it in and of itself is not going to fix this. It doesn't take away the need to mask, need to socially distance, wash your hands, stay home if you're sick, get a test if you have symptoms or you think you're going to be in a place where you might need to know that. So with that, Minnesotans, we're going to take a 2-minute break here, come back on with our socially distanced and remote media and take questions from them. Thank you.